Good day, everyone. So we will be discussing intellectual disabilities. This will be reported by Daniel Moras, Kim Estavas, and Jamil Madrano. So for the table of contents, we will be providing an overview and the etiology and prevalence of IED, which involves the causes and the prevalence of incidents, the signs and symptoms, as well as the pathomechanics, the types, degrees, and prognosis, and the treatment, management team, and SLP-related problems to each ID. So, what are intellectual disabilities? So, these are conditions that would involve problems in your mental areas, which could affect functioning in two different places, your intellectual functioning and your adaptive functioning. So, individuals with ID, they're characterized to have an IQ of 70 and below, and these are usually manifested before the age of 18. So the causes of intellectual disabilities could be singular, it could be a mix of different stuff. So the common causes are infections, chromosomal abnormalities, environment, metabolic, nutritional, exposure to toxins, and trauma causes. So there are 6 types of intellectual disabilities that we will be talking about today, which is your Fragile X syndrome, autism spectrum disorder, Down syndrome, developmental delay, and Prader-Willi syndrome, as well as fetal alcohol spectrum disorder. So generally, people with ID, they have the general intellectual functioning and their adaptive skills, which would include your social skills, conceptual skills, and practical skills. However, these different skills and functionings could be having problems. It could be delayed, or there are difficulties in some of these skills because of their conditions. That would depend on the severity. So now let us move on to the different IDs that we have to discuss with you today.
So this report is quite long, so I'm just going to go over the details and you can just refer to our written report. So first we have here the Fragile X syndrome, or also known as Martin-Bell syndrome. It is the most common intellectual disability, and for its etiology, it is a genetic disorder caused by changes in a gene. And then FMR1 gene usually makes a protein called Fragile X mental retardation protein, or FMRP. For the prevalence, FXS affects both males and females. However, females often have milder symptoms than males. The exact number of people who have FXS is unknown, but a review of research studies estimated that about 1 in 7,000 males and about 1 in 11,000 females have been diagnosed with FXS. So here's a photo or a picture of a person with FXS. So for the signs and symptoms and prognosis, for their physical signs, we have here the long or protruding ears, long or wide forehead, high and arched palate. For the cognition, males, they have moderate mental retardation, range from profound retardation to average intelligence. For the females, we have here the normal intelligence with learning disabilities to mild to moderate mental retardation. And for the males and females, they have visual, spatial, attention, executive function, and math difficulties. For their speech, we have here the perseverative and repetitive speech, reduced speech intelligibility, particularly in males, rapid and uneven rate, phonological delays, and for the oral motor, they have low muscle tone, motor planning and sequencing difficulties, and tactile defensiveness. For the language, they have difficulty maintaining a topic, interested in social interaction, word retrieval difficulties, and delays in vocabulary and syntax. And lastly, they have adaptive behavior, social anxiety and gaze aversion, hyperarousal and hypersensitivity to stimuli, stereotypic behaviors such as hand flapping, and short attention span and hyperactivity. For the prognosis, life expectancy for people with Fragile X syndrome is generally normal. Many affected people participate in an active lifestyle and have good health. For the precautions, medications carry serious risk. Other may make symptoms worse at first, or they may take several weeks to become effective. For the management, there is no cure for FXS. Treatment services is required and early intervention. And here are the therapies that the early intervention that is needed for the patients with FXS. So we have here special education, speech and language therapy, occupational therapy, behavior therapy, physical therapy, and medicines. For the management team, we have here physical therapists, behavioral therapists, speech language pathologists, and occupational therapists. For the support system in the Philippines, we have here the allies sa May Mga Kapansanan Association Inc. or AKAI, a non-government and non-stock organization registered under SEC number A200116478, designed to encourage and help people with physical and mental disability gain a sense of self-worth and hope that would enable them improve their lives and their future. True to its deal, the association has been conducting a variety of seminars and workshops to help those with disability develop their skills that may enable them to earn a living despite their condition. And lastly, we have here the SLP areas affected, the speech, hearing, and language. So for this part, since the previous group already discussed this thoroughly, I'm just going to recap what autism spectrum disorder related to the intellectual disability. So for the etiology, there is no known single cause for autism spectrum disorder, but it's generally accepted that it is caused by abnormalities in brain structure or function. Brain scans show differences in the shape and structure of the brain in children with autism compared to in a neurotypical children. Researchers do not know the exact cause of autism but are investigating a number of theories, including the links among heredity, genetics, and medical problems. So, for the prevalence, ASD is more than 4 times more common among boys than among girls. 1 in 160 children has an autism spectrum disorder worldwide. In the Philippines, estimated cases of autism rose from 500,000 in 2008 to 1 million people at present. For the signs, symptoms, prognosis, for the social communication and interaction, they fails to respond to his or her name or appears not to hear you at times, resists cuddling and holding, and seems to prefer playing alone, retreating into his or her own world, rather, has poor eye contact and lacks facial expression, does not speak or has delayed speech or loses previous ability to say words or sentences, and can start a conversation or keep one going or only start one to make requests or label items. For the patterns of behavior, performs repetitive movements such as rocking, spinning, or hand flapping, performs activities that could cause self-harm such as biting or head banging, develops specific routines or ritual and becomes disturbed at the slightest change, and has problems with coordination or has odd movement patterns such as clumsiness or walking on toes, and has odd, stiff, or exaggerated body language. For their pathomechanics, although there is no clear pathway of mechanism directed toward a simple pathogenesis and an established link to autism on the symptomatic level, there are however several important theories which appears to offer an explanation to how autism develops. It seems probable that autism's neurodevelopmental defect is multi-domain in origin and is hence distributed across numerous levels of study. For the type, course, and prognosis, the three types of ASD is the autistic disorder, Asperger syndrome, and the pervasive developmental disorder. For the course, first symptoms frequently involve delayed language development, often accompanied by lack of social interest, odd play patterns, and unusual communication during the second year. Odd and repetitive behavior and the absence of typical play become more apparent. For the prognosis, patients with autism are highly correlated with their IQ. Low functioning patients may never live independently. They typically need home or residential care the rest of their lives. For the management, they have treatment services and early intervention. So here are the examples: speech and language therapy, occupational therapy, behavior therapy, physical therapy, and cognitive therapy. For the management team, we have here the occupational therapists, physical therapists, SPED teachers, audiologists, and speech language pathologists. For the support system in the Philippines, we have here the National Autism Care Plan Act or House Bill number 6936 and the Autism Society of the Philippines. For the SLP areas that are affected, we have here the speech, hearing, language, and swallowing.
Next, we have Down syndrome. As was discussed in our previous lectures, DS is usually genetic, and the most common cause of this is because of trisomy 21. However, other genetic mutations such as mosaicism and translocation may also cause Down syndrome. It is the most common chromosomal disorder, and according to WHO, has 1 to 1,100 live births with children born with Down syndrome. It is also known that prevalence of Down syndrome increases as the mother's age increases. For the signs and symptoms, people with Down syndrome have similar physical features such as a flattened face, almond-shaped eyes that slant up, a short neck, small ears, a tongue that tends to stick out of the mouth, tiny white spots on the iris of the eye, small hands and feet, a single line across the palm of the hand, small pinky fingers that sometimes curve toward the thumb, poor muscle tone or loose joints, and they are shorter in height as children and adults. Down syndrome affects multiple systems and causes both structural and functional deficits. Gross motor and language delays are evident, and cognitive impairment can range from mild to severe. There may also be impairments in the functionality of the immune system and its responses. There are 3 noted types in Down syndrome. These are trisomy 21, translocation, and mosaicism. Trisomy 21 is the most common type with 95% prevalence, and it is caused by a chromosomal anomaly. Next is the translocation with 4% prevalence. It is hereditary and is caused by a part of a chromosome being transferred to another chromosome. Lastly, we have mosaicism with 3% prevalence. It is caused by a mix of 2 or more cells. Down syndrome is a lifelong condition. However, early and appropriate intervention can drastically improve the conditions of this syndrome. They have greatly increased morbidity, primarily due to impaired immune responses, and these impairments may also lead to accelerated aging, leading to decreased cell activity and body responses. People diagnosed with Down syndrome may experience progressive disorders at an earlier age, such as dementia at 40 to 50 years old. There is no known cure for Down syndrome. However, specific symptoms and problems may be treated. Doctors can conduct surgery for heart and gastrointestinal problems, as well as hormone replacement therapies. Early intervention and treatment programs are important in order to improve their skills. The management team is composed of family and caregivers, social workers, SLPs, occupational therapists, physical therapists, medical specialists, psychologists, and pediatricians. Several conditions may co-occur with Down syndrome, such as congenital heart defects, gastrointestinal problems, physical and structural problems, motor coordination and programming difficulties, hearing, and visual problems. As such, we need to take these into consideration as well. The SLP-related problems that may arise: for their speech and language, they may experience language delays, difficulty with grammar, tenses, and expression. It is important to note that receptive language is usually higher than expressive language, so many of their difficulties lie more in the expressive aspects. For hearing and perceptual impairments may come with Down syndrome, which leads to delay in language learning. For feeding, motor difficulties may arise due to low muscle tone, and poor oral motor coordination may lead to problems in sucking, swallowing, and lip closure. The support systems in the Philippines: we have Down Syndrome Association of the Philippines Incorporated, which was founded in 1991, and it is a non-profit organization that offers support to families who have a child with Down syndrome, and to initiate, develop, promote, encourage, and support programs and projects concerning Down syndrome. Next, we have the Proclamation number 157, which declares February as the National Down Syndrome Consciousness Month in order to raise awareness. Next, we have developmental delay. This refers to a child who has not gained the developmental skills expected of them compared to others of the same age. There is no single cause for delays in development, and the noted causes may occur before, during, or after birth. Some discovered causes include genetic or hereditary conditions, metabolic disorders, trauma to the brain, such as shaken baby syndrome, severe psychosocial trauma, such as PTSD, exposure to certain toxic substances like prenatal alcohol exposure or lead poisoning, some very serious infections, and deprivation of food or environment. Globally, pediatric population ranges from 5% to 15% in the prevalence of developmental delay. Signs and symptoms vary from one child to another. Signs may be noticed during infancy or they may not be noticed until school age. Common symptoms include learning and developing more slowly, rolling over, sitting up, crawling, or walking much later, difficulty communicating or socializing with others, lower than average scores on IQ tests, difficulty talking or talking late, having problems remembering things, inability to connect actions with consequences, difficulty with problem solving or logical thinking, trouble learning in school, and inability to do everyday tasks like getting dressed or using the restroom without help. Delays can affect a child's physical, cognitive, communication, social, emotional, or behavioral skills. These may also affect more than one area of development. Studies have found that language delay was associated with differences in brain volume in a number of key regions such as the temporal lobe, insula, ventral basal ganglia, and brainstem structures. Not only that, but functions may also be associated with the white and gray matters in the temporal, frontal, and cerebellar structures. For the types of developmental delay, we have cognitive, motor, social, emotional, and behavioral, speech, daily living activities, and global developmental delay. For cognitive, they have delays in their thinking skills, such as their learning, exploration, solving, and etc. For motor, they have delays in fine and gross motor movement. This may also be caused by genetic or structural conditions. For social, emotional, and behavioral, they have diminished ability to relate to other people, regulate and understand, as well as express emotions. For their speech, they have difficulties using and understanding language. For daily living activities, they have difficulties handling everyday tasks. And global developmental delay is a delay in more than one or all of these areas. In milder cases of developmental delay, the delay can be outgrown through early and appropriate intervention. Additional support can help children with delay catch up to the typical age development. In more severe cases, the delay may be more significant and ongoing support is needed. This may also indicate that they have a learning disability. For the management, there is no medication for developmental delay, and therapy is the most common treatment for children diagnosed with delay. The team responsible for managing developmental delays include physical therapists, occupational therapists, SLPs, SPED teachers, early intervention therapists, pediatricians, medical specialists, behavioral therapists, family, and caregivers. It is very important to note that treatment varies according to the specific delay and children progress at different rates. We should consider the child's other conditions, as these delays may co-occur with disabilities such as autism, Down syndrome, ADHD, sensory disorders, and more. Noting the child's case can help in the creation of an intervention plan that is unique and best fitted for the client. For the SLP-related areas, we have speech and language, which can cause delayed onset of verbal language, imitation, cooing, babbling. It may also manifest as a diminished use of nonverbal language, such as gestures, expression, and pointing. For hearing impairments may lead to delayed acquisition of language. And for feeding, delay in motor skills may lead to uncoordinated swallowing, sucking, and feeding. There is no specific law or support group for children with developmental delays. However, the Philippines has acts and regulations that promotes education for children with disabilities such as No Child Left Behind Act and Individuals with Disabilities Education Act.
So now we will move on to Prader-Willi syndrome. So this is an example of individuals diagnosed with PWS or Prader-Willi syndrome. So PWS is a neurogenetic disorder that results in a number of physical, mental, and behavioral problems. So it is usually noticed after birth. So according to the Foundation for Prader-Willi Research, PWS is considered a spectrum where not all challenges or symptoms found in PWS are experienced by everyone affected by it. So the etiology. It is genetic in nature and it is known as the most common genetic cause of life-threatening childhood obesity. So this results from an abnormality of chromosome 15. So this can happen in three different ways. So first is PWS by deletion, which comprises of 70% of cases. So part of the chromosome 15 inherited from the father is deleted or missing. This is because chromosome 15 comes from both the mother and father, so you have two copies of it. PWS by UPD, or known as maternal uniparental disomy, or the UPD, comprises of about 30% of cases. So the inheritance of two chromosome 15s come from the mother and none from the father. PWS by imprinting defect, however, is about 1 to 3% of cases, wherein small genetic mutation causes the parental chromosome 15 genetic material to be inactive despite it being present. So the prevalence of incidence, it's 1 in every 10,000 to 30,000 births, with equal prevalence between the males and the females. So signs and symptoms would include increased appetite, learning difficulties, hypotonia or weak muscles, lack of sexual development, behavioral problems, and distinctive features. So here are its details. So onto the pathomechanics, it is known that there is disrupted functioning of the hypothalamus due to the abnormalities in chromosome 15. So because of this, there could be problems with hunger, growth, sexual development, body temperature, and sleep. So the types, course, and prognosis. So the diagnosis of PWS could happen by doing a blood test, specifically the methylation analysis and genetic testing. So this will allow identification of chromosomal abnormalities that can indicate PWS. For life expectancy, they are just as typical individuals with life expectancy. However, the quality of life may shorten life expectancy, such as with obesity. So, of course, in life, they need significant support from their family, school, work, and their therapists. So the management for PWS. So early diagnosis and treatment can help improve the quality of life for individuals with PWS. So first we have hormone treatments. So it could be your growth hormones or your sex hormones. So for the growth hormones, it can normalize your height, increase lean body mass, increase mobility, and decrease fat mass. While for your sex hormones would help reduce secondary sex characteristics. Developmental therapy may help individuals with PWS learn age-appropriate behavior, social skills, and interpersonal skills, while AAC may be provided to individuals with PWS who need help building vocabulary and pragmatic language skills, especially when hypotonia is severe. For medications, they may be prescribed serotonin reuptake inhibitors or SRIs to help reduce obsessive compulsive symptoms and psychosis. So the management team would consist of these people: the pediatrician, endocrinologist, the dietitian, SLPs, PTs, OTs, and either your psychologist or your psychiatrist. So the medical precautions, we have to be familiar with the current and the past medications to indicate contraindications with therapy. We have to have multidisciplinary communication with other therapists and other people who are handling the child. And we have to stick with the routines and gradual shift with activities because individuals with PWS have a tendency to stick to routines. So the support systems for individuals with PWS. First, we have the Foundation for Prader-Willi Syndrome. So it is established in 2003 and aims to eliminate the challenges of PWS by advancement of research and therapeutic and development. Next, we have the Department of Health Senate Bill 3087, or the Rare Disease Act of the Philippines. So it is the provision of timely health information and adequate medical care to help individuals with rare diseases cope with their condition, as well as the establishment of the National Rare Disease Registry. So lastly, SLP related issues. So due to oral abnormalities with the mouth, so they have reduced articulatory skills. They have hypotonia, thus causing hyper or hyponasality and feeding issues. And due to cognitive problems, they may have poor narrative skills, delayed RL and EL, while for behavioral problems, they have poor pragmatic skills, and for speech sound errors that they have, this would lead to poor speech and sound development. Let us move on to FACID, or fetal alcohol spectrum disorder. So an example of a patient with FACID is Centoya Brown. Watch it on Netflix if you haven't. It gives you a really good concept of FACID. So FACID is basically a group of conditions that can occur to a person who is exposed to alcohol in utero. So the effects could lead to physical, learning, and behavioral problems, oftentimes a mix of both. So the etiology is commonly prenatal exposure to alcohol. However, pregnancy beyond the age of 30 years with a history of alcohol could lead to higher risk, poor nutrition, as well as the likelihood of having FACID once your older siblings already have FACID. So the prevalence is 7.7 per 1,000 births nationwide as of 2017. Here are the signs and symptoms. I suggest you pause and try to read on it because it's quite lengthy. For the pathomechanics, so alcohol can cross the placenta and blood-brain barrier of the fetus, thus damaging the brain's development. So there's no actual known mechanism yet to how alcohol could cause the characteristics of FACID. However, some stuff were hypothesized, such as fetal hypoxia, impairment of embryogenesis, disruption of cell signaling pathways, and cell damage or cell death. So now on to the types of FACID. First is fetal alcohol syndrome. So it's the most involved end of the FACID spectrum. So individuals here would have CNS problems, minor facial features, and growth problems. They'd have problems with their learning, memory, attention span, and etc. They'd oftentimes have a hard time in school and socializing. So alcohol-related neurodevelopmental disorder, these are individuals with intellectual disabilities and problems with their behavior and learning. So they do not do well in school, especially with their memory, attention, judgment, and poor impulse control. For alcohol-related birth defects, these are the people who might have heart, kidney, bones, or hearing problems. So the course and prognosis of FACID. So individuals here would undergo poor growth, poor balance coordination, hearing, and or vision, delayed development, and they could have behavioral problems, which could lead to poor social skills. They oftentimes have learning difficulties and poor fine motor skills. And most individuals, especially when undiagnosed leading to adulthood, they have mental health problems, oftentimes get in the way of the law. They could be imprisoned and they could either be charged for substance abuse and go to rehab. So yes, there's substance abuse, and they could even have sexual inappropriateness and difficulty living independently and unemployment. So for the management, there's no actual cure and it lasts a lifetime. However, early diagnosis and early treatment could lead to better outcomes when it comes to imprisonment and substance rate. So there's the diagnosis before 6 years old could help, absence of violence and abuse at home, special education and social services, as well as a loving, supporting, stable home and environment. So on to the actual treatment. So medical care would involve your therapy as well as doctor visits and testings. So medications. So there's no actual medication for FACID. However, some medications could help improve the symptoms. So we have the stimulants, antidepressants, neuroleptics, and anti-anxiety drugs. So for behavior and education therapy, this would help them focus on learning social skills as well as understand their triggers and how they could improve their behavior. And lastly, parent training. This would help parents understand their child's disability and how they could cope with it. Lastly, we also have the alternative approaches. These usually involve anti-anxiety approaches such as yoga. So now for the management team, we have the seven. We have the primary care physician, social services, special education teachers, SLPs, PTs, OTs, and your psychologist or your psychiatrist. For the medical precautions, it is important for us to know the current and past medications to know the contraindications when it comes to therapy with these medications. We have to create routines and gradual shifting of activities. We have to provide them with constant supervision and regulated exposure so that we could prevent the triggers that we have to know also. Support systems, we have Senate Bill number 1476 and 1756. These two are actually related. It's providing information to everyone who purchase alcohol about the warnings and the problems of drinking alcohol while pregnant. So here are some SLP related issues. These are usually your language problems involving speech discrimination, comprehension, syntax development, prosodic features, rule of dialogue, poor performance in sentence combining, expressive delays, working memory deficits, disturbances in semantic elaboration, pragmatics, and social communication deficits. And that is all. We will see you later on integration.